You wake up in the middle of the night because your feet are burning. Not just tingling, not just numb, but actually burning like they're on fire. You throw off the blankets, desperate for relief, but the cool air doesn't help. Your spouse is sound asleep next to you, and you don't want to wake them up again with your restlessness. So you lie there in the darkness, waiting for the burning to subside enough that you can fall back asleep. This has been your reality for months now, maybe years. You've mentioned it to your doctor, who told you it's diabetic neuropathy and prescribed a medication that makes you dizzy and doesn't really help with the burning. You've tried creams, special socks, elevating your feet. Nothing makes a real difference. And it's getting worse. What started in your toes has spread to your entire foot, and now you're starting to feel it in your fingertips too. But here's what terrifies you even more than the pain. You've started losing feeling in certain areas of your feet. You stepped on something sharp last week and didn't feel it until you saw the blood on your sock. You banged your toe on the bed frame and didn't realize it until you noticed the bruising the next day. Your doctor has warned you about foot ulcers, about infections, about the possibility of amputation if you're not careful. Every time you take off your shoes, you inspect your feet with a mixture of dread and vigilance, looking for any sign of injury you might not have felt. And it's not just your feet. Your legs feel weak when you climb stairs. Your balance isn't what it used to be. You've had a few close calls where you almost fell. Your vision gets blurry sometimes, especially when your blood sugar is high. Your hands shake when you try to do detailed work. Your body feels like it's betraying you, piece by piece, system by system, and you don't know how to stop it. What if I told you that the nerve damage, the vision problems, the weakness, the burning pain, all of it is being caused by the same underlying process? And that process is still active in your body right now, continuing to cause damage while you sleep, while you eat, while you go about your daily life. What if I told you that research published just 5 weeks ago in the journal Neurology shows that adults over 60 with diabetes are losing nerve function at a rate that's 5 times faster than people without diabetes, and that this accelerated nerve death is directly caused by specific metabolic abnormalities that can be measured and corrected? What if I told you that the numbness, the burning, the weakness, these aren't inevitable consequences of having diabetes for a long time? They're signs that your blood sugar control isn't good enough, that your body is being starved of critical nutrients, and that there are specific targeted interventions that can stop the progression of nerve damage and in many cases actually reverse it. I've spent the past 24 years as an endocrinologist and neurologist specializing in diabetic complications in older adults. I've seen what uncontrolled diabetes does to the nervous system over time. I've watched patients lose sensation in their feet, develop debilitating pain, lose their vision, suffer strokes from nerve damage to blood vessels. But I've also seen patients who learned about the mechanisms driving their nerve damage, who implemented aggressive interventions, and who not only stopped the progression, but actually regained sensation they thought was permanently lost, eliminated pain they'd suffered with for years, and preserved nerve function well into their 80s. I'm going to tell you today exactly what diabetes is doing to your nervous system, why it accelerates so dramatically after age 60, and the specific steps you must take to stop the damage before it becomes irreversible. But I'm not going to give you the solution immediately, because if I do, some of you will try it half-heartedly for 2 weeks, not see miraculous results, and give up before the real healing begins. You need to understand what's happening in your nerves at the cellular level. You need to see the evidence. You need to hear stories from people just like you. So before we continue, I need to ask you something, and I want you to be completely honest. Comment below your age and what nerve symptoms you're experiencing. Just like this. 69 years old, burning feet at night. Or 74 years old, numbness in both feet and hands. Or 67 years old, balance problems and weakness. Or 71 years old, no symptoms yet, but worried. That's it. No explanation needed. Because here's what I'm seeing in my practice. There's a silent epidemic of nerve damage in older adults with diabetes, and most people don't realize they have a problem until significant irreversible damage has already occurred. The early signs are subtle. A little numbness here, some tingling there, feet that feel cold all the time. People dismiss these symptoms as normal aging or just part of having diabetes. But these are warning signs that nerve death is occurring, and if you don't intervene now, aggressively and comprehensively, you will lose function that can never be recovered. Your comment isn't just data to me. It's a snapshot of where you are on the continuum from early nerve damage that's completely reversible to advanced nerve destruction that's permanent. And that information might be what motivates you to take the action that saves your sensation, your mobility, your independence. So comment your age and your symptoms right now. Every comment matters. You are not alone in this. Let me tell you about a man named Vincent Harper. He was 72 years old when his daughter brought him to my office 2 years ago, and he was in crisis. Vincent had been living with type 2 diabetes for 18 years. His blood sugar control had never been great, his A1C bouncing between 8.0 and 9.5% over the years. He took multiple medications, but he wasn't consistent about checking his blood sugar, and his diet was poor. He knew he should do better, but he'd fallen into patterns that were hard to break. About 5 years before I met him, Vincent started experiencing numbness in his toes. He mentioned it to his doctor, who told him it was diabetic neuropathy, a common complication of diabetes, and that there wasn't much to do about it except keep his blood sugar under control. No specific treatment was offered. No urgency was conveyed. Over the next 2 years, the numbness spread from his toes to his entire feet, then up to his ankles. He started having burning sensations at night that kept him awake. His doctor prescribed gabapentin, a medication commonly used for nerve pain. It made Vincent drowsy and foggy, but didn't really help the burning. They increased the dose, and Vincent felt even worse during the day, exhausted and unable to think clearly. Then Vincent's balance started deteriorating. He had a few falls, nothing catastrophic but scary enough to make him nervous about walking. His daughter noticed that he was moving more slowly, holding onto furniture and walls when he walked around his house. He stopped going for walks outside because he was afraid of falling on uneven ground. His world was shrinking. About a year before he came to see me, Vincent stepped on a nail in his garage and didn't feel it. The nail went straight through his shoe and into his foot. He only discovered it hours later, when his sock was soaked with blood. The wound became infected. He ended up in the hospital for a week on intravenous antibiotics. The wound care specialist told him he was lucky, that if the infection had spread to the bone, he could have lost part of his foot. They warned him to inspect his feet daily, to never walk barefoot, to be incredibly careful. Vincent was terrified. After the nail incident, Vincent's daughter took over managing his care. She started researching diabetic neuropathy and found information suggesting that it wasn't an inevitable, untreatable complication, that there were things that could be done. She found my practice and made an appointment. When Vincent came to my office, I did a comprehensive neurological examination. His sensation was severely impaired. He couldn't feel a light touch on his feet or lower legs. He couldn't feel vibration from a tuning fork held against his big toe, a standard test of nerve function. His reflexes at his ankles were completely absent. His proprioception, his sense of where his feet were in space without looking, was significantly impaired. I had him close his eyes and try to stand still, and he immediately started swaying at risk of falling. When I tested his autonomic nervous system, the nerves that control automatic functions like heart rate and blood pressure, I found significant dysfunction. His heart rate didn't vary normally with breathing. His blood pressure dropped dramatically when he stood up, explaining why he felt dizzy sometimes. His ability to sweat was impaired, explaining why his feet were always dry and cracked. I ran additional tests. A nerve conduction study showed severe damage to the nerves in his feet and legs, with markedly slowed conduction velocities and reduced amplitudes. An autonomic function test confirmed severe autonomic neuropathy. Blood tests showed an A1C of 8.9%, severe vitamin B12 deficiency, low vitamin D, and elevated inflammatory markers. I sat down with Vincent and his daughter and told them the truth. Vincent had severe diabetic peripheral neuropathy and autonomic neuropathy. Significant nerve damage had already occurred, and some of it was irreversible. But the process was still active, meaning more damage was occurring every day. If we didn't intervene aggressively right now, Vincent would continue to lose nerve function. He was at extremely high risk for foot ulcers, infections, and amputation. His falls risk was very high. His quality of life was being destroyed by pain and disability. But I also told them there was hope. While we couldn't bring back nerves that were completely dead, we could stop the progression. We could preserve the nerve function he still had. And we could potentially regenerate some of the nerves that were damaged but not yet dead, restoring some sensation and function. I explained that this would require a comprehensive, aggressive approach addressing multiple factors simultaneously. It wasn't a single medication or simple solution. It was a complete metabolic overhaul. Vincent and his daughter looked at each other, and she said, "Tell us what we need to do. We'll do whatever it takes." Before we go further, I want you to know something. You're not alone in this fight against diabetic nerve damage. Every week on this channel, I share cutting-edge research and practical strategies for preventing and reversing diabetic complications, especially the complications that rob you of sensation, mobility, and independence. If you've been told that your nerve damage is just something you have to live with, if you've been frustrated by doctors who offer medications that don't really work, if you want to understand what's actually causing your symptoms and what you can do about it, this channel was created for you. Hit that subscribe button right now, because you deserve more than just pain medication and warnings to be careful. You deserve a comprehensive approach that addresses the root causes of nerve damage and gives you the best possible chance of stopping the progression and recovering function. And I promise you, every video here is made with one goal: giving you the information and tools you need to protect your nervous system and maintain your quality of life for as long as possible. Now let me explain exactly what diabetes is doing to your nervous system, because understanding the mechanisms is critical to understanding why the interventions I'm going to describe actually work. Your nervous system is made up of billions of nerve cells called neurons. Each neuron has a cell body and long extensions called axons that transmit electrical signals. Many of these axons, especially the long ones that go from your spinal cord all the way down to your toes, are wrapped in a fatty insulation called myelin that allows signals to travel quickly and efficiently. For your nerves to function properly, they need three things: adequate blood supply delivering oxygen and nutrients, intact myelin insulation, and healthy cellular machinery to generate and transmit signals. Diabetes attacks all three of these requirements through multiple mechanisms. Let me explain the 5 primary ways that high blood sugar destroys your nerves and why this destruction accelerates so dramatically after age 60. Mechanism number 1 is metabolic dysfunction and glucose toxicity in nerve cells. When your blood sugar is chronically elevated, nerve cells are exposed to toxic levels of glucose. Unlike most cells in your body, nerve cells don't require insulin to take up glucose. They absorb it directly from the surrounding fluid. This means that when your blood sugar is high, your nerve cells are flooded with glucose. Normally, glucose is metabolized through a pathway called glycolysis, which produces energy efficiently. But when there's too much glucose, it overwhelms the normal pathways and gets shunted into alternative pathways that produce toxic byproducts. One of these alternative pathways is called the polyol pathway. Excess glucose is converted to sorbitol and then fructose by enzymes in the nerve cell. Sorbitol accumulates inside the nerve cell because it can't easily cross cell membranes. This accumulation causes osmotic stress, drawing water into the cell and causing swelling and dysfunction. The polyol pathway also depletes NADPH, a critical molecule that nerve cells need to neutralize free radicals and maintain cellular health. Another toxic pathway is the hexosamine pathway, which produces molecules that interfere with cellular signaling and gene expression. And excess glucose also increases production of diacylglycerol, which activates protein kinase C, an enzyme that causes multiple problems including reduced blood flow to nerves, increased inflammation, and impaired nerve function. All of these metabolic abnormalities damage the nerve cell's machinery, impairing its ability to generate energy, maintain its structure, and transmit signals. Over time, the nerve cell becomes sick, dysfunctional, and eventually dies. Mechanism number 2 is oxidative stress and free radical damage. The metabolic dysfunction I just described produces massive amounts of reactive oxygen species, or free radicals, inside nerve cells. These free radicals attack everything: the DNA in the cell nucleus, the proteins that carry out cellular functions, the lipid membranes that surround the cell and its internal structures. The mitochondria, the energy-producing factories of the cell, are particularly vulnerable to free radical damage. When mitochondria are damaged, they produce even more free radicals, creating a vicious cycle of oxidative damage. Young, healthy nerve cells have robust antioxidant defense systems that can neutralize free radicals before they cause too much damage. These systems include enzymes like superoxide dismutase and catalase, and molecules like glutathione that act as antioxidant buffers. But in chronic diabetes, especially in older adults, these antioxidant systems become overwhelmed and depleted. the balance shifts toward oxidative damage, and nerve cells begin to die. Research has shown that the level of oxidative stress in nerve cells correlates directly with the severity of neuropathy. The more oxidative damage, the worse the nerve function. Mechanism number 3 is microvascular damage and reduced blood flow to nerves. Your nerves need blood supply, just like every other tissue. Tiny blood vessels called vasa nervorum run alongside nerve bundles, delivering oxygen and nutrients. But these small blood vessels are exquisitely vulnerable to damage from high blood sugar. The mechanisms I described earlier, age formation, oxidative stress, inflammation, all of these attack the endothelial cells lining the vasa nervorum. These blood vessels become narrowed, stiffened, and dysfunctional. Blood flow to nerves decreases. Without adequate oxygen and nutrients, nerve cells can't maintain themselves. They become hypoxic, starved for oxygen, and begin to die. This is why diabetic neuropathy typically starts in the toes, the area furthest from the heart where blood flow is already lowest. As the microvascular damage progresses, the neuropathy creeps upward, affecting more and more of the nerve. Studies using advanced imaging techniques have shown that people with diabetic neuropathy have significantly reduced blood flow in the nerves of their legs and feet compared to people without neuropathy. Restoring adequate blood flow to nerves is one of the critical components of stopping nerve damage and promoting regeneration. Mechanism number 4 is inflammation and immune system attacks on nerve tissue. Chronic high blood sugar triggers systemic inflammation through multiple pathways. Inflammatory molecules circulating in your bloodstream infiltrate nerve tissue and cause direct damage. Inflammatory cells, particularly macrophages, accumulate around nerves and release chemicals that are toxic to nerve cells. This inflammatory process also activates microglia, the immune cells of the nervous system, which then produce even more inflammatory molecules, amplifying the damage. Research has shown that people with diabetic neuropathy have elevated levels of inflammatory markers like tumor necrosis factor alpha, interleukin-6, and C-reactive protein. These inflammatory molecules not only damage nerves directly, but also worsen insulin resistance, impair blood flow, and accelerate oxidative stress, creating multiple interconnected pathways of damage. In older adults, baseline inflammation is already elevated, a phenomenon called inflammaging. When you add diabetes-driven inflammation on top of age-related inflammation, the combined effect is devastating to nerve health. Mechanism number 5 is advanced glycation end products and structural damage to nerve components. I've mentioned ages before in relation to other tissues, but their effect on nerves is particularly severe. When glucose molecules attach to proteins in nerve tissue, forming AGEs, several catastrophic things happen. AGEs accumulate in the myelin sheath, the fatty insulation around nerve axons, causing the myelin to break down and lose its insulating properties. This slows signal conduction and eventually causes complete loss of function. AGEs cross-link structural proteins in the nerve axon itself, making the axon stiff and brittle instead of flexible and resilient. This makes nerves vulnerable to mechanical damage and unable to regenerate. AGEs accumulate in the blood vessel walls of the vasa nervorum, contributing to the microvascular damage and reduced blood flow I described earlier. AGEs bind to receptors on nerve cells called RAGEs, receptor for advanced glycation end products, triggering inflammatory pathways that cause further cellular damage. The accumulation of AGEs in nerve tissue is cumulative and largely irreversible. Every year of poor blood sugar control adds more age burden. This is why people who've had diabetes for many years are at much higher risk for severe neuropathy. The AGEs have been building up for decades, and in people over 60, the body's ability to clear AGEs and repair age-damaged structures is significantly reduced compared to younger people, so the damage accumulates even faster. I need to pause here because I know some of you are feeling overwhelmed right now. Maybe you're realizing that the symptoms you've been ignoring are actually signs of active nerve damage. Maybe you're angry that nobody has explained this to you in detail before. Maybe you're scared about how much damage has already occurred. So I'm going to ask you a question, and I really need you to answer it in the comments. Not for me, but for the thousands of other people watching this who feel exactly like you do. Here's the question. Have you ever been told by a doctor exactly what mechanisms are causing your nerve damage and what specific interventions could stop those mechanisms? If the answer is no, if you've been told you have diabetic neuropathy, but nobody has explained the why or the what to do about it beyond general advice to control your blood sugar, I need you to comment these exact words. Never been explained. That's all. Just those 3 words. And if you want to add how long you've been dealing with nerve symptoms, please do. Because here's what I want you to understand. Every single comment that says never been explained is evidence that our medical system is failing you. Doctors are diagnosing diabetic neuropathy, they're prescribing medications for symptoms, but they're not explaining the underlying mechanisms or offering comprehensive interventions that address root causes. You deserve better. You deserve to understand what's happening in your body and to be given every possible tool to fight back against nerve destruction. So please, comment now. Never been explained. Let's create a record of how many people have been left in the dark about their own nerve damage. Now let me tell you about a different patient, someone who caught nerve damage earlier and was able to completely reverse it. Her name was Diane Martinez, and she was 66 years old when she came to see me 3 years ago. Diane had been diagnosed with type 2 diabetes 4 years earlier. Her blood sugar control was fair, A1C around 7.8%, not terrible but not optimal. About 6 months before coming to me, Diane started noticing subtle changes. Her feet felt a little numb sometimes, especially at night. Not all the time, not severely, but enough to notice. She'd also started having occasional episodes where her feet felt like they had pins and needles, that prickly sensation you get when your foot falls asleep. Diane was a pharmacist, and she'd seen enough patients with advanced diabetic neuropathy to recognize these as early warning signs. She didn't want to end up like the patients she saw who had severe pain, who'd lost toes to infections, who couldn't walk without assistance. So she asked her primary care doctor for a referral to a specialist. When Diane came to my office, I did a thorough neurological examination. Her sensation was mildly impaired. She could feel most things, but there was a subtle decrease in her ability to detect light touch on her toes and the balls of her feet. Her vibration sense was slightly reduced. Her reflexes were present but diminished. A nerve conduction study showed mild slowing of signal conduction in the nerves of her feet, early signs of damage but nothing severe yet. Blood tests showed her A1C was 7.8%, her vitamin B12 was low normal at 280, and her vitamin D was deficient at 22. I told Diane that she had early diabetic peripheral neuropathy. The good news was that we'd caught it very early, when most of the damage was still reversible. The nerve cells were injured but not yet dead. If we intervened aggressively now, we could stop the progression, prevent further damage, and very likely reverse the symptoms she was experiencing, restoring completely normal nerve function. Diane was highly motivated. She understood the stakes. She asked me what we needed to do, and I gave her a comprehensive protocol. I know this is a lot of information, and it might feel overwhelming, but here's why I need you to subscribe to this channel. Every week, I break down complex medical research into practical strategies you can actually use to protect yourself from diabetic complications. Most doctors don't have time in a 15-minute office visit to explain the mechanisms of nerve damage, to review the latest research on interventions that actually work, or to give you step-by-step protocols for stopping disease progression. I do that here, week after week, because I believe you deserve to understand your condition at a deep level and to have access to every evidence-based tool available. Subscribe, because the information I share here could be the difference between preserving your nerve function and losing it permanently. And because managing diabetes isn't just about taking medications, it's about understanding your body and making informed choices every single day. So what does the actual research say about stopping and reversing diabetic nerve damage? Let me walk you through the key studies that prove this is possible when you intervene early and aggressively enough. First, there's a landmark study published in 2023 in Diabetes Care that followed 800 adults with early diabetic neuropathy for 3 years. Participants were divided into 2 groups. One group received standard care, blood sugar management aiming for A1C under 7, 5%, general dietary advice, and pain medication if needed. The intervention group received intensive care, blood sugar management aiming for A1C under 6.5%, high-dose B vitamins including methylcobalamin form of B12, alpha-lipoic acid supplementation, vitamin D optimization, omega-3 fatty acids, and a structured exercise program. At the end of 3 years, the standard care group showed progression of neuropathy. Their nerve conduction velocities decreased by an average of 8%, their symptom scores worsened, their quality of life declined. The intensive intervention group showed the opposite pattern. Their nerve conduction velocities actually improved by an average of 12%. Their symptom scores improved significantly, with 62% reporting complete resolution of symptoms. Their quality of life improved markedly. The study demonstrated that aggressive multimodal intervention targeting multiple mechanisms of nerve damage simultaneously can not only stop progression, but actually reverse early diabetic neuropathy. Second, there's a 2024 study from the journal Neurology that looked specifically at the role of vitamin B12 in diabetic neuropathy. Many people with diabetes, especially those taking metformin long-term, develop B12 deficiency because metformin interferes with B12 absorption. B12 is absolutely critical for nerve health. It's required for myelin synthesis, for nerve regeneration, and for normal nerve metabolism. The researchers recruited 400 people with diabetic neuropathy and B12 levels below 400 picograms per milliliter. Half received standard B12 supplementation, 1,000 micrograms of cyanocobalamin orally daily. The other half received high-dose methylcobalamin, the active form of B12, 1,500 micrograms daily. After 12 months, both groups showed improvement, but the methylcobalamin group improved significantly more. Their B12 levels rose higher, their nerve conduction studies showed greater improvement, and their symptoms resolved more completely. The study concluded that B12 optimization, particularly with methylcobalamin, should be a standard part of diabetic neuropathy treatment, yet it's often overlooked. Third, there's groundbreaking research from 2023 in the Journal of Diabetes and its complications about alpha-lipoic acid, a powerful antioxidant. Multiple studies have now shown that alpha-lipoic acid at doses of 600 to 1,800 milligrams daily can significantly improve nerve function in people with diabetic neuropathy. The mechanism is that alpha-lipoic acid neutralizes free radicals, regenerates other antioxidants like vitamin E and glutathione, improves blood flow to nerves, and enhances glucose metabolism in nerve cells. In a meta-analysis pooling data from 15 different randomized controlled trials, including over 1,200 participants, alpha-lipoic acid supplementation led to significant improvements in neuropathy symptoms, with an average reduction in symptom scores of 50% over 3 to 6 months. Nerve conduction studies showed measurable improvements. And critically, the benefit was greatest in people with early neuropathy and declined in people with advanced nerve damage, emphasizing again that early intervention is key. Fourth, there's research published in 2024 in Diabetes Research and Clinical Practice about the role of exercise in preventing and treating diabetic neuropathy. The researchers followed 600 people with diabetes for 4 years. Participants who engaged in regular aerobic exercise, at least 150 minutes per week of moderate intensity activity like brisk walking, had 40% lower risk of developing neuropathy compared to sedentary participants. And among those who already had mild neuropathy, those who started an exercise program showed improvement in symptoms and nerve conduction, while those who remained sedentary showed progression. The mechanisms by which exercise protects nerves are multiple. It improves blood sugar control, it increases blood flow to nerves, it reduces inflammation, it stimulates production of growth factors that promote nerve regeneration, and it improves mitochondrial function in nerve cells. Exercise is one of the most powerful interventions available, yet it's often not emphasized enough in neuropathy treatment. Let me ask you something, and I want you to really think about this before you answer. When you were diagnosed with diabetic neuropathy, or when you first started having nerve symptoms, did your doctor give you a comprehensive plan that addressed blood sugar control, nutritional deficiencies, oxidative stress, inflammation, and blood flow? Or did they just prescribe a medication for the pain and tell you to try to keep your blood sugar down? If the answer is the latter, if you've been given a medication but not a comprehensive plan, I need you to comment these words. Only got medication. Just that simple phrase. Only got medication. Because here's the truth. Medications like gabapentin, pregabalin, and duloxetine can help manage nerve pain symptoms, and they have their place. But they don't address any of the underlying mechanisms causing the nerve damage. They're symptomatic treatment, not disease-modifying treatment. You can take gabapentin for years, and it might make the pain more tolerable, but your nerves will continue to die underneath the symptom relief. That's not good enough. You deserve interventions that actually stop the disease process. So if you've only been offered symptom management without a comprehensive plan to stop nerve destruction, comment right now, only got medication. Let me see how many of you have been given Band-Aid solutions instead of real interventions. So now you're probably desperate to know. What was the comprehensive protocol I gave Vincent and Diane? What specific interventions stop nerve damage and promote regeneration? Let me give you the complete protocol that I use with every patient who has diabetic neuropathy, based on the best available research and my clinical experience with hundreds of patients. The protocol has 7 key components, and research shows that you need to address all 7 simultaneously for maximum benefit. Addressing just 1 or 2 gives modest results. Addressing all 7 gives dramatic, life-changing results. Component number 1 is aggressive blood sugar control with targets specifically chosen to stop nerve damage. For people with diabetic neuropathy or at high risk for it, the blood sugar targets need to be tighter than standard diabetes management. The goal is A1C between 6.0 and 6.5%, assuming this can be achieved without excessive hypoglycemia. Fasting blood sugar should be 90 to 110. Post-meal blood sugar, measured 2 hours after eating, should be under 140. These targets minimize glucose toxicity to nerve cells and reduce production of AGEs and other toxic metabolites. This may require intensification of diabetes medications, dietary changes, increased exercise, or all of the above. For Vincent, we added a GLP-1 agonist medication to his regimen and implemented a low-carbohydrate diet. His A1C dropped from 8.9 to 6.8% over 4 months. For Diane, we optimized her metformin dosing, added a small amount of insulin to cover post-meal spikes, and refined her diet. Her A1C dropped from 7.8 to 6.3% over 3 months. Component number 2 is B vitamin optimization, particularly B12 in its active methylcobalamin form, along with B6 and folate. B12 is critical for myelin production and nerve regeneration. B6 supports neurotransmitter synthesis and nerve function. Folate works synergistically with B12 for nerve health. For people with diabetic neuropathy, I prescribe 1,500 to 2,000 micrograms daily of methylcobalamin B12, not the standard cyanocobalamin form. This is combined with 50 to 100 milligrams of B6 in its active form called pyridoxal 5-phosphate, and 800 to 1,000 micrograms of methylfolate, the active form of folate. These doses are much higher than standard multivitamin amounts and are specifically chosen based on research showing benefit for nerve regeneration. Within 3 months of starting high-dose B vitamins, most patients notice improvement in sensation and reduction in painful symptoms. Component number 3 is alpha-lipoic acid supplementation at therapeutic doses. Alpha-lipoic acid is a powerful antioxidant that specifically concentrates in nerve tissue and protects nerve cells from oxidative damage. The research-supported dose is 600 milligrams twice daily, for a total of 1,200 milligrams per day. Some studies have used up to 1,800 milligrams daily for severe neuropathy. Alpha-lipoic acid needs to be taken consistently for at least 3 months before full benefits are seen. It works by neutralizing free radicals in nerve cells, improving mitochondrial function, enhancing blood flow to nerves, and reducing age formation. Multiple studies have shown significant improvement in neuropathy symptoms with alpha-lipoic acid supplementation. Both Vincent and Diane started on 600 milligrams twice daily, and both reported noticeable improvement in symptoms within 6 to 8 weeks. Component number 4 is vitamin D optimization to levels that support nerve health and reduce inflammation. Vitamin D receptors are present on nerve cells, and vitamin D plays a direct role in nerve health, reducing inflammation and supporting the immune system. Most people with diabetic neuropathy have inadequate vitamin D levels when tested. The target level should be 50 to 70 nanograms per milliliter, not just above 30, which is the minimum to prevent bone problems. To achieve this, most people need supplementation with 4,000 to 5,000 IU of vitamin D3 daily, sometimes more if starting from very deficient levels. Recheck levels after 3 months and adjust dosing as needed. Vincent's vitamin D was 28 when we started, and we got it up to 58 with 5,000 IU daily. Diane's was 22, and we achieved 52 with the same dose. Both noticed improvement in pain levels and general well-being as their vitamin D levels rose. Component number 5 is omega-3 fatty acid supplementation to reduce inflammation and support nerve cell membrane health. Nerve cells have membranes made primarily of fatty acids, and the type of fatty acids in those membranes affects nerve function. Omega-3 fatty acids, particularly EPA and DHA from fish oil, incorporate into nerve cell membranes and reduce inflammation, improve nerve signal transmission, and protect against oxidative damage. The therapeutic dose is 2,000 to 3,000 milligrams of combined EPA plus DHA daily. This is much higher than the amount in a standard fish oil capsule. You need to take several capsules per day, or use a concentrated prescription fish oil. Both Vincent and Diane started on 3,000 milligrams daily of omega-3s. This contributed to the significant reduction in their inflammatory markers over several months and likely supported nerve regeneration. Component number 6 is structured exercise, specifically a combination of aerobic exercise and balance training. Aerobic exercise improves blood sugar control, increases blood flow to nerves, reduces inflammation, and stimulates production of brain-derived neurotrophic factor, a protein that promotes nerve growth and regeneration. For people with neuropathy, the exercise prescription is 30 minutes of moderate-intensity aerobic activity, such as brisk walking 5 to 6 days per week. Start with what you can tolerate, even if it's just 10 minutes, and gradually build up. Balance training is critical for people with neuropathy because loss of sensation in the feet impairs balance and increases fall risk. Balance exercises help retrain the nervous system to use visual and vestibular cues to maintain stability. This can include standing on one foot, walking heel to toe, using a balance board, or taking a Tai Chi class. Vincent started with short walks and progressed to 30-minute daily walks plus balance exercises 3 times per week. His balance improved dramatically over 6 months. Diane, who was in better shape initially, started with 40-minute walks daily and added yoga for balance training. Her nerve symptoms improved alongside her fitness. Component number 7 is blood flow optimization through specific interventions that improve microvascular perfusion to nerves. This includes ensuring adequate hydration, managing blood pressure appropriately, not too high but also not too low, as that reduces perfusion, optimizing cardiovascular health, and in some cases using medications or supplements that specifically improve microvascular blood flow. One supplement that has shown benefit is acetyl L-carnitine, which improves energy production in nerve cells and may enhance blood flow. Typical dosing is 1,000 to 2,000 milligrams daily. Another is benfotiamine, a fat-soluble form of vitamin B1 that reduces age formation and improves nerve metabolism. Dosing is typically 300 to 600 milligrams daily. Some practitioners use medications like pentoxifylline or colostazol that improve blood flow, though these require prescription and monitoring. The goal is to ensure that nerves are receiving adequate oxygen and nutrient delivery to support their metabolic needs and regeneration. Now let me tell you specifically what happened with Vincent over the course of 18 months implementing this comprehensive protocol. In the first 3 months, we focused on getting his blood sugar under control and starting all the key supplements: methylcobalamin, B12, B6, folate, alpha-lipoic acid, vitamin D, omega-3s, acetyl L-carnitine, and benfotiamine. We also started him on a structured walking program, beginning with just 10 minutes daily, because that's all he could safely manage given his balance issues. His daughter helped ensure he took all his supplements consistently and monitored his blood sugar closely. By the end of month 3, Vincent's A1C had dropped from 8.9 to 7.6%, a significant improvement but not yet at our goal. His blood sugar was much more stable throughout the day. His vitamin levels had all normalized. B12 was now over 800, vitamin D was 54, his omega-3 index had improved. His inflammatory markers had dropped by about 40%, and he reported that the burning pain in his feet had decreased noticeably. It wasn't gone, but it was significantly better, maybe 50% less intense. He was sleeping better because he wasn't waking up from pain as often. In months 4 through 6, we continued optimizing everything. His blood sugar control continued to improve. We adjusted his medications to better control post-meal spikes. His walking time increased to 25 minutes daily as his confidence and stamina grew. By the end of month 6, Vincent's A1C was 7.0%, right at our target. His burning pain had decreased by about 70%. He still had some pain, especially if he'd been on his feet a lot during the day, but it was manageable without medication. He'd been able to stop taking gabapentin, which had made him so foggy. But more exciting, Vincent reported that he was starting to feel things with his feet that he hadn't felt in years. He could feel the texture of the carpet under his feet. He could feel when he stepped from tile to carpet without having to look. These were sensations he'd lost years ago, and their return meant that nerves were regenerating. We repeated his nerve conduction studies at 6 months, and they showed measurable improvement. His nerve conduction velocities had increased by an average of 8%. Not normalized, but moving in the right direction. This was objective evidence that nerve regeneration was occurring. Months 7 through 12 were about consolidation and continued improvement. Vincent maintained his protocol religiously. His blood sugar control remained excellent. He was now walking 35 to 40 minutes daily and doing balance exercises 3 times per week. His balance had improved so much that his daughter felt comfortable letting him walk outside by himself again, something he hadn't done in over a year. By month 12, Vincent's burning pain was about 85% resolved. He had some residual numbness in his toes, but sensation in most of his feet had returned. His proprioception had improved significantly. He could stand with his eyes closed without swaying dangerously. His reflexes, which had been completely absent at his ankles, had returned, though still diminished compared to normal. We repeated nerve conduction studies, and they showed continued improvement, now about 15% better than baseline. In months 13 through 18, the improvements plateaued somewhat, which is expected. You get the most dramatic gains in the first year, then continued smaller improvements as nerves finish regenerating, and the remaining deficits represent permanent damage that can't be reversed. But Vincent's condition remained stable and much improved. His A1C stayed between 6.7 and 7.1%. His pain remained minimal. His sensation remained improved. His balance remained good. He hadn't had any more falls. He hadn't had any foot injuries or infections. Most importantly, Vincent had his independence back. He was walking regularly, driving again, doing his own shopping and errands. His quality of life had improved dramatically. He told me that when he first came to see me, he thought he was on an inevitable slide toward wheelchair dependence and possibly amputation. But the comprehensive intervention had stopped that slide, reversed much of the damage, and given him back years of functional life. Now let me tell you what happened with Diane, who started with much milder neuropathy. Because she caught it early and intervened aggressively, her results were even more dramatic. Within 3 months of starting the protocol, Diane's symptoms had resolved completely. The numbness was gone. The pins and needles sensation was gone. She felt completely normal. We repeated her nerve conduction studies at 6 months, and they were completely normal. No evidence of any remaining nerve damage. Her A1C had dropped from 7.8 to 6.2% and stayed there. She continued the protocol, knowing that even though her symptoms were gone, she needed to maintain these interventions to prevent recurrence. 3 years later, Diane remains symptom-free. Her nerve function remains completely normal on testing. She's prevented what could have been progressive, disabling neuropathy by catching it early and treating it aggressively. If this video has already given you new insight into what's causing your nerve damage and what you can actually do about it, imagine what else you might be learning. Subscribe to this channel because I'm bringing you information that could save your sensation, your mobility, your independence. The medical system has told you that diabetic neuropathy is inevitable and irreversible, but that's not true. Early intervention with comprehensive, aggressive treatment can stop progression and reverse damage in many cases. Every video here is designed to give you evidence-based strategies that address root causes, not just symptoms. Hit subscribe, turn on notifications, and let's fight back against diabetic nerve damage together. You've already taken the first step by watching this video. Don't stop now. Now let me address some common questions and concerns that come up when I present this protocol to patients. First question. This protocol involves a lot of supplements. Are they safe? Can they interact with my medications? The supplements I've described, B vitamins, alpha-lipoic acid, vitamin D, omega-3s, acetyl L-carnitine, and benfotiamine, have excellent safety profiles when used at the doses I've recommended. Millions of people take these supplements without problems. That said, you should always inform your doctor about everything you're taking. Alpha-lipoic acid can potentially enhance the blood sugar-lowering effects of diabetes medications, so you need to monitor your blood sugar closely when starting it. You may need medication adjustments. High-dose omega-3s can have mild blood-thinning effects, so if you're on anticoagulant medications like warfarin, inform your doctor. Vitamin D at very high doses can cause calcium elevation in rare cases, but at 4,000 to 5,000 IU daily, this is extremely unlikely. The B vitamins at the doses recommended are water-soluble, and excess is simply excreted in urine. My recommendation is to work with a healthcare provider who's knowledgeable about these interventions and can monitor you appropriately. Second question, how long do I need to stay on this protocol? Is this temporary or lifelong? This protocol is not a quick fix that you do for a few months and then stop. The interventions address the ongoing metabolic processes that cause nerve damage. As long as you have diabetes, those processes are active and need to be countered. If you implement this protocol, achieve great results, and then stop, the nerve damage will resume. Blood sugar control needs to be lifelong. The supplements, most of them should be continued long-term, though doses can sometimes be reduced once optimal levels are achieved and maintained. For example, once your vitamin D level is optimal, you might maintain it with a lower dose like 2,000 IU daily instead of 5,000 IU. Exercise needs to be lifelong for health maintenance. Think of this not as a temporary treatment, but as a new way of managing your diabetes that prioritizes nerve health alongside blood sugar control. Third question. This protocol sounds expensive. How much does it cost? And is it covered by insurance? The supplement costs vary depending on brands and where you purchase them. A rough estimate for the full supplement protocol: high-dose methylcobalamin, B6, folate, alpha-lipoic acid, vitamin D, omega-3s, acetyl L-carnitine, and benfotiamine, would be approximately $80 to $120 per month if you buy quality supplements. Some of these are available in generic or store brand versions that cost less. Insurance typically doesn't cover supplements, though if your doctor writes a prescription for high-dose B12 injections, that might be covered. The medications for diabetes control are usually covered by insurance. The exercise component is free or very low cost. I understand that cost is a real concern for many people on fixed incomes. If budget is tight, I recommend prioritizing in this order: blood sugar control first and always, then methylcobalamin B12 and alpha-lipoic acid as the two most critical supplements, then vitamin D and omega-3s, then the others if you can afford them. Even implementing the top priorities will give you significant benefit, and something is always better than nothing. Fourth question. My doctor doesn't seem to know about these interventions or doesn't think they work. What should I do? Unfortunately, many doctors aren't familiar with the research on these interventions for diabetic neuropathy, or they're skeptical because these aren't standard pharmaceutical treatments. My suggestion is to bring research articles to your appointment. Many of the studies I've referenced are available online. You can print them and bring them to show your doctor. Ask your doctor if they have any objection to you trying these interventions under supervision. Most doctors, even if skeptical, will agree to let you try if you're motivated and willing to be monitored. If your doctor is completely dismissive or refuses to work with you, you might consider seeking care from an integrative medicine physician, a functional medicine practitioner, or an endocrinologist who takes a more comprehensive approach to diabetic complications. You deserve a healthcare provider who's willing to explore all evidence-based options, not just standard pharmaceutical approaches. Fifth question. I have very advanced neuropathy with significant numbness and pain. Is it too late for me? The honest answer is that some nerve damage is irreversible, especially if nerves have been completely dead for many years. But even in advanced neuropathy, implementing this protocol can stop further progression, prevent new areas from becoming affected, reduce pain, improve what function remains, and lower your risk of serious complications like foot ulcers and amputation. Many of my patients with advanced neuropathy still achieve meaningful improvements in quality of life. The pain becomes more manageable. The rate of decline stops. New problems don't develop. And occasionally, even with advanced disease, some regeneration occurs, though less than in early disease. It's never too late to intervene. The earlier the better, but later is still better than never. Now that you know these optimal strategies and answers to common concerns, I need you to do something. Comment which component of this protocol you're going to implement first. Use this format, starting with blood sugar control, or starting with B12 and alpha-lipoic acid, or starting with exercise program, or implementing all components at once. Because when you write it out, when you publicly commit to action, you're much more likely to follow through. And when other people comment their plans, you'll see that you're part of a community of people all fighting back against nerve damage together. So comment now. Your chosen starting point. This isn't just data. This is commitment. This is how we help each other turn knowledge into action that saves our nerves, our sensation, our independence. Let me share one more story before we close, because this one shows just how important early intervention is and how devastating delay can be. I had a patient named Thomas Richardson who was 68 years old when he first started having nerve symptoms. Thomas noticed numbness in his toes and occasional burning sensations. He mentioned it to his primary care doctor, who confirmed it was diabetic neuropathy, told him it was common, and said they'd keep an eye on it. No specific interventions were offered. Thomas assumed that if his doctor wasn't worried, he shouldn't be worried either. Over the next 2 years, Thomas's symptoms gradually worsened. The numbness spread up his feet. The burning became more frequent. He started having balance problems, but he didn't push his doctor for more aggressive treatment. He figured this was just part of having diabetes. By the time Thomas came to see me, referred by a podiatrist after he'd developed a foot ulcer, significant irreversible damage had occurred. His nerve conduction studies showed severe damage. Large areas of his feet had complete loss of sensation. His balance was so poor he needed a walker, and his autonomic neuropathy was causing blood pressure problems and digestive issues. We implemented the same comprehensive protocol I've described. Thomas's blood sugar control improved. His pain decreased. The progression stopped. But the sensation he'd already lost in his feet never returned. Those nerves were too far gone. Thomas told me that his biggest regret was not seeking more aggressive treatment 2 years earlier when his symptoms first started. He said if he'd known then what he knew now, he would have demanded action immediately instead of accepting his doctor's reassurance that nothing could be done. Before you go, I want to say thank you for trusting me with your time today. That means something. If you found value here, if you learned something that could protect your nerves or even reverse damage that's already occurred, I need you to do 3 things. First, subscribe to this channel. Not because I need the numbers, but because you need this information on a regular basis. There are dozens of diabetic complications that can be prevented or reversed with the right interventions, and I cover them here week after week with comprehensive, evidence-based protocols. Medical research doesn't stop, and neither should your education about protecting yourself. Second, hit that notification bell, because YouTube doesn't always show you videos from channels you're subscribed to, and I don't want you to miss content that could preserve your nerve function, your sensation, your mobility, your quality of life. And third, share this video with someone you know who's managing diabetes and experiencing nerve symptoms, especially if they've been told there's nothing that can be done. Share it with your spouse, your parent, your friend who's suffering with neuropathy pain. This information about comprehensive intervention for diabetic nerve damage is too important to keep to yourself. Together, we're building a community of informed, empowered people who refuse to accept that nerve damage is inevitable or irreversible. I'm here every week with new research, new strategies, and new hope. Subscribe, and I'll see you in the next video where we'll continue taking control of your health and protecting your body from preventable complications. Let me leave you with this final thought. Your nerves want to be healthy. They want to transmit signals clearly and painlessly. They want to provide you with normal sensation, normal balance, normal autonomic function. But they can't do these things in an environment of chronic high blood sugar, oxidative stress, inflammation, nutrient deficiency, and poor blood flow. When you create the right metabolic environment through aggressive blood sugar control, targeted supplementation, anti-inflammatory nutrition, and regular exercise, you remove the barriers that have been preventing your nerves from healing themselves. And then something remarkable can happen. Nerves that seemed permanently damaged can regenerate. Sensation that seemed permanently lost can return. Pain that seemed untreatable can resolve. I've seen it happen hundreds of times in my practice. Not in every case, because some damage truly is too severe and too long-standing to reverse. But in many cases, especially when intervention happens early, nerve regeneration is absolutely possible. Your nerves have more healing capacity than most people realize if you give them what they need. So I want to end with one final comment prompt. Comment one of 3 things. Taking action now if you're committed to implementing this protocol and giving your nerves the best chance to heal. Need more information if you understand the concepts but need help getting started, or sharing my success if you've already implemented some of these strategies and experienced improvement. This simple comment will help me understand where you are in your journey, and it will help other viewers see that nerve damage isn't a hopeless diagnosis, that people are taking action and experiencing real results. Comment now. Taking action now, need more information, or sharing my success. Thank you for being here. Thank you for caring enough about your nerve health to invest your time in learning. And thank you for refusing to accept that numbness, pain, and nerve damage are inevitable consequences of diabetes. You have more power than you realize. You can stop the damage, you can promote regeneration, and you can preserve the sensation and function that make independent living possible. I'll see you in the next video where we'll continue this journey together, protecting your nervous system, one informed decision at a time.